Hi, everyone. My name is Katie Connor. I'm an orthopedic surgery PA in Charleston, South Carolina, and I've been working PA education for about 10 years now. One of the most common questions that I get is, how do I prepare for rotation? So I wanted to create you this survival guide that's based on my experiences and the experiences of students I've met along the way. So these are things that will help you look like a professional and help you to avoid some of the rookie mistakes. Here are the subjects we'll talk about. General advice, housing, what to buy, what to bring, some helpful apps, and then the common do's and don'ts. For general advice, if you're having anxiety about rotations, that is normal. I'd be worried if you weren't having anxiety. You're going to be meeting a lot of new people, going to a lot of new places, doing a lot of new things. Try to channel that into more excitement than anxiety. But if you're truly having problems with the anxiety, make sure that you seek medical care prior to rotations. Rotations are what you make of them. A positive attitude and an open mind is everything. If people sense that you're excited about that rotation, they'll be excited to teach you. But if you walk in with a bad attitude, they're not going to want to teach you. Don't complain about your rotations. Let's say you got your list and you are disappointed that you didn't get everything that you asked for. You may learn the most where you least expect it. A lot of the rural rotations, people get more one-on-one and they get more hands-on experience because there's not 4 or 5 other students at that rotation. Try to be flexible. And I know that that is hard for type A personalities, but rotations can and will change unexpectedly. Preceptors get sick, preceptors get too busy, preceptors go on vacation. So it's important that you plan ahead and you have a plan B, C, D, so that you know what to do in case that change happens to you and you feel prepared for that. Housing, I think, is one of the most anxiety-inducing subjects about rotation. So I'm going to go through places that you can look to find housing. I was fortunate enough to have some AHEC housing for my rotations, and we'll talk a little bit more about that on the next slide, but that's free governmental housing. That's usually pretty good housing. Rental sharing with classmates. Make sure you check with the landlord to see if it's okay that they sublet to you, because you don't want to get in trouble with the landlord. But that can be a good way that you guys can help kind of share and defray the cost of rent for each other. Staying with classmate families, talk to your classmates, see if they have any families in the area that would be willing to rent a room to students. Asking local PA groups, for example, South Carolina, SCAPA. They will know which alumni and local PAs rent and provide safe spaces to students. We've been having students rent from us for a long time, and it's a great experience for me because we can kind of discuss patient cases, and it's a great experience for the student because they have a PA that they can talk to and ask questions about. Short-term rentals, things like Airbnb, these can be good with one caveat. Make sure you look and see if the area is safe. I've had students that have booked Airbnbs, they show up and it's a crime-filled, really scary area. So make sure you check out that area and make sure it's safe before you book it. Extended stay hotels can be good in a pinch, but be aware that about 4 to 5 weeks of extended stay hotels will generate about $4,000 to $5,000 worth of bills. So this is not something I would use to plan for your long-term housing. Friends and other PA programs. Let's say you have to go out of state. There may be a local PA program there where you can either ask their clinical director or their students where they find safe housing. If you're really in a pinch and you have no idea and you're struggling, ask your preceptor if they have any suggestions. They've been precepting students for a while. They've probably heard through the grapevine where those students are staying at, or they may have friends, or they may have a property, themselves that you can rent from. AHEC housing, I mentioned this one. Again, I was fortunate enough to have AHEC housing, and I had some really awesome apartments that I stayed in. AHEC stands for Area Health Education Centers, and they have these in most US states and territories. The trade-off is it's free housing, which is awesome. You may have to drive a little bit further to get to your rotation based on where that free housing is. So the trade-off is you're paying more gas money, but you're getting free housing. So consider these first. Be aware that there will be students of other medical programs that are in that shared housing. I had a PT, OT, pharmacy student, and a med student that we all lived together in an apartment. Also be aware that these are co-ed. So if that's something that you don't feel comfortable with, just be aware of that. Usually they provide you pots, pans, cooking utensils, serving utensils. I personally felt a little bit better bringing my own. So I went to Costco, got a big, thing of silverware, disposable glassware, disposable dishes. And that way I didn't have to do dishes and I didn't have to use somebody else's stuff. Bedding and towels, linens. So pillows, towels, bedding, you're going to have to bring all of that. Most of the mattresses will be either twin or full. And so when you're buying that bedding, keep that in mind that if you buy a full, that is bigger and it will fit a twin. If you buy a twin, it may not fit a full. Most of them will have on-site laundry, but that's something that you should check prior. If they don't, make sure that you pack enough outfits that you can get through the entire week without having to run and find laundry somewhere. Pets are not allowed in any AHEC housing. And the reason for this is that if a pet bites somebody in the house, they're liable. Pets are also associated with property damage. If somebody brings their Great Dane or their pit bull in and they destroy the carpet, then they're responsible for that. So you will need to make plans with what to do with your pets while you're on rotations. What to buy. This is a checklist of things that I thought was very important. Some students prefer writing rather than typing, so a small notebook that fits in your white coat pocket. I used an iPad mini. I thought this was really important because it looked like I was doing something important rather than just texting on my phone. And some preceptors will say, oh, well, they were on their phone the whole time. And you may have been doing legitimate work, but it looks like you're texting. So an iPad mini kind of takes away that perception. Get a box of professional looking thank you notes. After each rotation, you'll want to send one. So nothing weird, nothing funny. I just had stationery that had my name on it and a simple thank you on the inside. Personalized business cards for networking. You may have tons of networking opportunities along the way, and the ultimate goal is for you to get a job. So if you can hand that business card out to somebody, that's great. The key point is most of your schools will cancel your school emails within about 3 weeks. So create some kind of Gmail account and make sure it's your Gmail account that's on those business cards that you hand out. If you're moving a lot, lots of duffel bags, lots of storage containers to make it easier for you to haul in and haul out and move a lot quicker. Comfortable and professional shoes. You'll hear me talk about this several times during this presentation. Shoes that are easy to wipe off, that are very comfortable, are so important. And if you're going to spend money prior to rotation, do it on shoes. You will thank yourself later. 3 pairs of student scrubs at least. Your program will probably give you an embroidered emblem or logo on your scrubs. See if you can get extra pairs of those. You will not regret it. And if those are too expensive, just buy some plain navy scrubs or some plain light blue scrubs so that you have enough to get through the week. Business casual clothes. If your rotation does not allow scrubs, finding clothes that look professional, but you're not spending a ton of money on them. And we'll go through this in a further slide here a little bit down the road. 2 white coats. Your program will provide you with one. See if you can purchase another. And if you can't, just get a plain white coat. You'll always have your name badge with you, so that will be fine. Your white coats will get filthy on rotations, and having an extra one will be really important. So spend some money on that too. In your car, the last thing you want to do is drive to your rotation and realize that you forgot to put on deodorant that morning. Have a can of spray-on deodorant in your car because the sticks can melt. So having that will be one less thing you have to think about. That extra change of clothes or that extra white coat that we talked about, keep that hanging in your car so that if you are in your peds rotation and somebody throws up on you or you're in the ER and blood gets on you, you can quickly run out to your car and now you have a brand new outfit. Phone, car charger, or fuel cell. A lot of the hospital systems will be constantly searching for service, and a lot of hospitals don't get great service. So you'll walk out to your car and your phone will be dead and you have to figure out how to get back to your housing. So having a car charger or fuel cell can help you not be nervous about how do I find my way home. Wrinkle release spray, brand names, Downy, Febreze, spray, stretch. Now all of your wrinkles are gone. It is so important for you to look professional and polished, and wrinkles can take away from that. Lint roller. If you have a dog or a cat, do a quick little, lint roll to make sure that you don't have any pet hair on you. Tide stain stick. They're about this big. If you spill coffee on your coat or have a little tiny stain, you can just rub it on. And by the time you go into your rotation, you'll look clean. Snacks and bottled water. If you are on a 12-hour rotation, you don't have time to eat and you get into your car and you're absolutely starving, it's always a nice, welcome thing to have bottled water or a pack of peanut butter crackers there that you can eat on the way home. On your person, the most common piece of medical equipment that you'll be wearing is a stethoscope. And if you don't need it, let's say you're on your orthopedics rotation, you'll find out pretty quickly that you don't need to bring it. But most primary care and internal med rotations will want you to have this. Your iPad or your small notebook that we talked about, tuck it into the pocket of your white coat. A pocket mirror or a phone camera. Let's say you eat lunch and you've got a big old honking piece of broccoli in your teeth. Before you go back to see your patients or your preceptor, just take a quick look. An extra pair of gloves. When you walk in the morning, take a pair of gloves and put it in your white coat pocket, because if you're in a situation where you've got bodily fluids flying all over the place and you don't have to go find gloves, you've got them right there in your pocket. Glucose tabs for people who get squeamish or pass out easily. You want to make sure that that's not due to low blood sugar. So those glucose tabs are very small. You fit them in your pocket. If you're going into a surgery that you think is going to be particularly gruesome, pop one of those and make sure that you've got that in your system so that you're not passing out from low blood sugar. Hair ties. Anybody that has long hair, that will need to be pulled back, especially in your surgery rotation, to fit all of your hair under the cap. Also important if you're on your peds rotation, they'll pull your hair, or if you're doing a procedure, leaning your hair over into that procedure is not something that you want. Lots of pens. Everybody will take your pens. Your patients will take your pens, your medical assistant, your preceptor. Make sure you've got plenty of pens so that when you go in to interview your patient, you're prepared. These were apps that I found helpful and I downloaded onto my iPad. Apocrates is great for a pharmaceutical reference. I think it's one of the most in-depth ones. My go-to is Medscape. I love Medscape. It's easy to use. It's kind of summarized. It's got dosages. It's got medications. It's also got free CMEs on there so that if you have some downtime as a provider, which you may or may not, you can get some free CMEs on that. Up-to-date may or may not be provided by your program. If it's not, it is pricey. I like Up-to-Date as a provider, but I think it's a little bit too in-depth for some students. If you're looking for a simple answer, it can be kind of hard to dig through all of the layers there. Google Translate. Hospitals are required by law to have a translation service, but let's say you're in a rural place that doesn't have great internet or you don't have that access to that app. Google Translate is a quick way that you and your patients can go back and forth that will make you feel more comfortable and know that you understand each other. Elmo loves ABC seems kind of silly, but if you're on your peds rotation and you have to give kids shots, it's so much nicer to walk in with Elmo while you're giving them their shot, and it'll be a better experience for you and a better experience for that patient. Physical exam, something like Bates. This is great. Let's say you're on your orthopedics rotation and there's a suspected ACL tear and you're like, I can't remember, varus, valgus, what anterior, posterior drawer. It can walk you through that exam so that when you walk in to see the patient, you're refreshed on that before you go in there. Teach Me Surgery, I think, is really cool. As a surgical PA, it teaches you virtually the procedures before you go in and see it happen in real life. Snellen eye chart is just kind of a basic medical equipment that we need. Easier than carrying a Snellen eye chart is just to have an app for it on your iPad. Lab values reference. Your labs will come with references, but I think these are nice apps to have if you're like, what were the thyroid labs? What were the hypercoagulable labs? What were the rheumatology panel? And it will kind of remind you what to order when you're working up a certain diagnosis. Each of your programs will have a patient logging app. The one that we used was Typhon. It's pretty easy to use. It teaches you how to chart. What was the chief complaint? What was the history? What was the physical? What was your assessment? What was your plan? Because half of your job is going to be charting. And so it gives you this kind of practice at doing that. PANCE question bank is key. I loved Lang personally. So I would be on that rotation. I would do the rotation specific questions. And then anything that I answered incorrectly at the end, I would get a list that I could go back and study so that I knew when I took that callback exam for that rotation, I had already kind of studied and I'd hit my target areas prior to that. Calvin's another one. Roche is another one. I just personally really liked Lang. So our do's and don'ts, these are common mistakes that people make on rotations, and this is my way of helping you avoid those and look like a true pro here. What to wear, we're gonna start there. Your first impression is so important, and how do people make impressions is how you look. Don't wear anything that shows cleavage, stomach, underwear, above the knee. When you're buying clothes, make sure you kind of, reach your arms up, reach your arms down, make sure your butt crack isn't showing when you lean over, because that's an awkward situation to have that happen in clinic. Business casual clothes or scrubs, whichever one your rotation requires, get some that you're okay with ruining. Don't spend thousands of dollars on clothes. Thrift stores, eBay, if you want to buy new clothes, Ann Taylor, New York and Company for women are great places to buy that, but they're probably going to get ruined. So don't spend a ton of money on them. Just make sure that they're functional and they're professional. Looking polished. I've said this several times. Don't show up on your first day with wrinkly clothes. No wrinkled clothes, no stained clothes. Get the pet hair off your clothes before you go in. Keep that clean outfit in your car in case you need a backup in a pinch, but make sure you look at yourself in the mirror before you walk in there. Keep your feet happy. So important. You'll be on your feet for 12 hours a day, especially if you're in the ER. Do not wear any high heels, boots, ballet flats, flops, or open-toed shoes. There are DHEC requirements that say you cannot wear open-toed shoes in a medical facility. The other reason is your feet will look like hamburger meat by the time that you're done that rotation. You're going to have blisters. You're going to be super sore. Find comfortable shoes that look professional, that are easy to clean. That's kind of my criteria for shoes. I personally love Footwear RX by Landau. I probably had 60 pairs of these over the last 10 years. In orthopedics, I do a lot of splints. I get plaster on my shoes. I can quickly wipe these off. They don't have a heel on them. They've got lots of arch support and padding. On Clouds are a relatively newer one. Super comfortable, super expensive, and hard to clean off. So, just a couple things on that one. Danskos are another one. Danskos tends to have a little bit more of a heel. Some people like that, some people don't. Minimizing your jewelry. Do not wear large engagement rings. I had a student who got her ring caught in the glove, threw it in the trash, and didn't realize it till hours later. And then they had to spend so much time digging through the trash to try to find that ring. Also, large engagement rings can rip gloves. Large earrings can get pulled on in your pediatrics rotations, and no jewelry whatsoever for your surgery rotation. I have heard of several students who've had a ring, they tie it to the scrub pull tab, and then they end up putting it in the laundry, and now they can't find it. So no jewelry for surgical rotation. If you are on a rotation where you can wear jewelry, keep it to a wedding band, keep it to stud earrings. A lot of hospitals require that you remove your facial piercings, so just go ahead and do it anyways. Be neutral and be natural. Acrylic nails are a big no-no. They can harbor bacteria, and most hospital systems will not allow that. Your surgery rotation will be insistent that you cannot have those. Don't have a distracting hair color. You want things to be natural. You want things to be neutral. And visible tattoos. Again, that may be a hospital policy that you can't have visible tattoos. That's a pretty common one. So trim your nails, use a neutral or no polish, have your natural colored hair, and cover any tattoos with either long sleeves or a sleeve. Scrub your social media. You don't want to not get a job because you put something on your Facebook page 10 years ago that they have now gone through and said, oh, that looks a little questionable. Don't post anything about drinking, smoking, drugs, politics, or controversial subjects. You would say, Katie, this sounds kind of common sense. Well, it should be, but it happens a lot. So erase anything questionable from your history. You can disguise your name, use your middle name, or don't use your last name. Or if it's going to take you longer to go back and delete it, or to go back and delete individual things, just delete your profile. You don't want to not get a job because of something on Facebook 10 years ago. Your rotation schedule. When you get that schedule, you may be elated, you may be disappointed. Do not complain that you didn't get the rotations that you wanted. Look at each of those as a learning opportunity. We've already said this. The more rural, the more one-on-one, and the more hands-on, and you may end up walking out of that rotation loving that rotation. Always contact your preceptor prior to the rotation. Do not assume that your preceptor will contact you, and don't even assume that they're going to remember that you're coming, because they may have agreed to that a year ago. Email your preceptor or the office manager, ask them about the dress code, ask them about where specifically you need to meet your preceptor, when you need to arrive on the first day. Do you want me 45 minutes early? Do you want me to come in a little later to give them a chance to get ready? What time do you want me there? Find out the location of your rotation. Don't wait till the morning of your rotation to drive there and find out that you forgot to factor in the commute. It's really confusing. You can't find the building. Try, if you can, to visit prior, or at least check your GPS to determine the commute time. Always factor in traffic. And if you can't find it, call the office manager and say, hey, I found the general area, but I couldn't find the specific place. Can you give me further instructions so you know exactly where to be on that first day? Addressing your preceptor. One of the most awkward mistakes that students make is they are too informal with their preceptor. Do not call your preceptor by their first name unless they give you permission to do so. You always want to start out formal and then work your way down. So call them by their professional title. Dr. Smith, PA Smith, Nurse Practitioner Smith, Mr. Smith, Mrs. Smith. If you're not sure, ask them how they want to be called. And that way they can have the opportunity to tell you, oh, don't worry about it. My name's Katie. Just call me Katie. We're kind of casual around here. If they don't say that, assume that they like the formality. Showing up. Do not be late and do not ask to leave early unless you're truly sick or it's an emergency. And this is really important for your program. Make sure that you immediately report your absences to your clinical director so that they can notate that. And if you have to make that up, you'll have time to do so. I like the 15-minute rule. Make sure you arrive 15 minutes early so that you can familiarize yourself with the schedule, drink your cup of coffee, get ready to go. Bringing food. Do not assume that there will be a place there for you to get food on site, especially if it's a private practice or not in a hospital system. Bring non-perishable snacks and drinks until you determine what is that food situation. Is there a fridge? Do I have time to eat? Is there something on campus that I can get? And that way you're fully prepared. Interacting with the staff. Do not be rude or unfriendly to anyone, even if it's just the front desk or just a medical assistant. Those people are a key important part of that team. And you don't know how close they are with your preceptor. So if you walk in as a student with a snotty attitude, they may go back and tell your preceptor, hey, that person wasn't very nice to me. You always want to start out with a good impression. Also, don't expect that every staff member wants to teach you. Some people don't like students. Some people think that they're, annoying or they get in the way. Don't be offended by that, but just kind of find out who those people are and, leave them alone. Be friendly and listen to any advice that anybody wants to give you, especially those seasoned veterans. The nurses, the medical assistants, they run that show. So if they're willing to spend some time and give you some advice, I highly recommend you listen to that and become friends with them. Be open to feedback. This is really important. Some people get their feelings very hurt when somebody gives them feedback. If somebody gives you feedback or you make a mistake and they tell you, say, thank you for bringing that to my attention. I will make sure I don't make that mistake again. They're making the effort to tell you this so that you don't make that mistake in the future and potentially have a worse outcome. So be very open to that. Using the computer. When you go to your rotation site, there will be a computer there that your preceptor may or may not allow you to use. Do not change or chart anything on the computer without asking. This can have legal ramifications. So your preceptor may say, here, go chart all my notes. Or your preceptor say, I don't want you to chart my notes. Make sure you find out before you assume. Do try to learn as many electronic medical records as possible because you don't know which one you'll have in your future career. And if you can get a little training on that, that's awesome. Some of the common ones are Epic or eClinicalWorks or Athena. Those are the more common ones. Try to practice charting as much as you can. If you can chart on their chart, great. If you have to chart in your program specific one, for example, Typhon, try to be thorough about it. Don't just give this cursory chart because when you get into practice, the more you have done it, the better you will be. So try to be honest about those logs and try to put as much detail as possible. Talking with your preceptor. Do not feel like you have to just continually talk to fill the void. A lot of times your preceptor is charting or they're thinking about something. And if you're just constantly yammering in their ear, they don't like that. A lot of surgeons like to be very quiet. So don't take that as they don't like you. It's just that they're kind of quiet. I have worked for surgeons my entire career, and I know that a lot of them just don't like to talk. Learn when your preceptor wants to talk and when they want to do other things working on charting. And if they're charting, go in a separate room and work on your, PANCE questions or your charting of patients. Asking questions about patients with your preceptor. Do not question your preceptor in front of a patient. You want to wait until you're outside of that room. Write it down and then ask a question during their downtime, or you say, hey, I had some questions on these patients. Can I ask you? Make sure you're out of earshot for all patients. And for example, maybe you learned, something in school that this is the first line medication for this, and your preceptor doesn't write that. Rather than saying, hey, I learned it this way. Why are you doing it this way? You can say, hi, when I was in school, I learned that this was first line. Can you explain to me why you don't? And they may have a logical reason, like insurance doesn't cover it. It's $50 and my patients can't afford that. So that way you're having a learning opportunity without embarrassing them in front of their patients and without sounding confrontational. Preceptor asking you questions as they're trying to quiz you and teach you. If you have a question, ask questions that do not ask questions that you can easily look up. You want to ask thoughtful questions. If your preceptor is saying to you, what do you think about this? Or why do you think this is? You want to say, okay, I like this. Here I think is what my answer is. Ask thoughtful questions that continue that conversation, that shows that you're processing the information and that you're using your training and skills. You don't want to ask them, a simple question that you should know from your training. That just doesn't make you look professional. When your preceptor questions you as you guys are having these patient discussions, and they may say, tell me the etiology of this, or tell me what you think is the first line medication. Don't get the same questions wrong repeatedly on the same topic. It's okay to miss something. I mean, it's okay, we're human. But you don't want to get the same question wrong time after time after time, because it says you're not learning. Also, don't try to completely blindly guess. Give yourself a minute to kind of think about the answer and formulate a logical, reasonable answer. Look up any topics that you were asked about to be prepared the next day. So you go home and you say, okay, I didn't understand this about otitis media. You go in the next day and you say, Dr. Smith or PA Smith, you had asked me this question about otitis media and I didn't know the answer. So I did some homework on this last night and this is what I think my answer should have been. Can you tell me if I was right or wrong? And that way you open that discussion back up, you correct your mistake, and it shows that you're learning from that. And that's a really good way for them to put on your eval, didn't know at first, but went back and corrected the mistake. Introducing yourself to patients. Don't ever allow a patient to assume that you are a licensed medical professional. This has legal ramifications. Also, don't lose your badge. It is a super pain to replace, especially if you're in a rural rotation, you lose your badge, you have to come back to your program to get another one. You always want to have your badge displayed prominently that says student, and you want to introduce yourself. Hi, I'm Katie Connor. I am Dr. Smith or PA Smith's PA student. They'll be joining us shortly. I just wanted to chat with you and see what was going on. And that way the patient knows there's somebody else coming in. You have set the expectations for that visit. Interviewing your patients. Your first 2 or 3 rotations, you may get in there and have no idea what to ask. Don't panic if you forget what to ask. If you look like you're sweaty and anxious and you don't know what you're doing, that patient is not going to tell you anything. They will feel very uncomfortable. So try to be calm and collected. Use your history taking outlines and write notes until you're comfortable with that interview. That's okay to write notes. It actually looks like you're more involved in that interview. Taking a history. Try not to spend more than 10 minutes taking a history for a focused complaint, because your preceptor, they have patients to see, they've got a lot of patients on the schedule and you don't want to bog them down. Try to learn how to show empathy, good listening skills, but redirect and focus the interview to stay on time. So for example, if you see that this patient has something they just want to get off their chest and tell you, let them tell you. That'll usually take up a minute or so of your time. And then you say, I'm so sorry that happened to you, or mercy, I can't believe that. You're here for this complaint today, and it's very important to me that we get that addressed so that, something like that doesn't happen again in the future. So thank you for telling me that, and that's really important for me to know, but let's talk a little bit more about why you're here. And you'll develop those skills as you, practice longer and longer. Examining your patient. Don't ever act like anything is beneath you. Taking vitals, you may say, oh, that's a nurse's job, or that's a medical assistant job. No, it's everybody's job. You need to know how to take a blood pressure, how to take a temperature, how to take a pulse, how to read these things, because you never know when you're going to be short-staffed, and you need to know how to professionally do this. Never ever document an exam finding that you didn't check. Sometimes these electronic medical records will say auto-populate, and it'll give you what a normal exam is, and it'll say normal rectal tone or normal vaginal mucosa. Well, you didn't look at that, so you need to make sure you delete that out. Always try to do a full exam, head to toe on the patient, minus the invasive, unless that's why they're there, so that you can learn what a normal is. You'll have to do 100 normals to say, oh, that was abnormal, because I didn't know what was a normal and an abnormal. Get very efficient and very, you'll find as you go head to toe, ear, nose, and throat, cardiology, GI, neurology, and you get in this order and you get in this habit of quickly and efficiently doing the exam so that you can pick up on these abnormal findings. Patient exam and treatment. Never, ever assume that you're allowed to do anything invasive in an exam or a treatment. That includes rectal exam, that includes vaginal exam, that includes breast exam. Make sure you check with your preceptor to make sure that's okay. Or sutures. I have a patient who comes in with a hand laceration. I'm going to suture this up, and your preceptor walks in and you're finished suturing. Always ask your preceptor prior to doing anything invasive. And if they say no, don't get your feelings hurt. Say, okay, can I watch you instead? And they'll usually be okay with that. Presenting the case. Your job as a PA is to say, okay, I've seen this patient, in certain circumstances, and say, okay, here's the things that I think are important. Here's the diagnosis. Here's where we need to go with this patient. Giving a polished presentation is so important, and there's an art to this. When you see a patient, you're going to think in your mind, what are the pertinent positives and negatives? Don't just come out rambling to your preceptor, irrelevant information, forget to give your differential, and have no plan for a workup or diagnosis of this patient. Do give a focused presentation. I have practiced this in my mind. Here's the pertinent positives, here's the pertinent negatives, here's my proposed differential diagnosis, and here's the workup and plan that I'd like to do. And that will be one of the best ways you can interact with your preceptor. Doing procedures. Okay, we've done the history, we've done the physical. Now we know we need to do a procedure. Don't ever as a student feel forced to do an unfamiliar exam or procedure that could potentially harm the patient because you don't know what you're doing. Speak up and say, I've never done this before. Can I have you supervise me, or can I watch you do it first? Always speak up, because it's patient care and it's potential for patient harm that we don't want to have here. It takes practice to be, good at suturing or good at doing procedures, and you really want to watch somebody do it and then you feel comfortable. But if they give you the opportunity to be supervised while you're doing it, take it and run with it. Do it as many times as they'll allow you to do it, and you will kind of develop these skills as you go through the rotation. Awkward situations will happen. It is medicine. Patients may say something to you that is awkward or inappropriate. My point here is violence is never okay. You never have to, be abused by a patient, but they may say something, that might be, a little sexual in nature, a little insulting in nature. Try not to get offended easily. Try to grow some thick skin. Again, violence is not okay, but if comments hurt your feelings, try to see how much of that you should really be concerning yourself with. Do not go and report your preceptor or report patients over minor issues and say, I don't like this rotation because some patients don't like students and they don't want to see me. Don't go back to your clinical director and say, well, my feelings are hurt. Try to develop a sense of humor about this. This will serve you well in medicine. If the patient says something that is truly inappropriate to you, you say, Mr. Smith, that was very inappropriate. You're here for a medical exam today, and we don't have time for, antics of that nature. So you can address it in a tactful way. A lot of patients don't realize they're being inappropriate. You may have a really old man that comes in and says, well, aren't you pretty? They're not saying that to be mean, but you say to them, I'm a medical provider and that's not, appropriate in this situation. Passing out. That happens frequently, and that is okay. It is a natural part of your anatomy. If you feel lightheaded, ringing in your ears, or tunnel vision, you are going to pass out. And the reason is your body is dropping all your blood into your legs, and the only way you can get that back to your brain is if your body drops you down on the floor. Don't try to fight through it. You will end up face planting either in the surgical field or on the floor. If you feel those symptoms, sit down or leave the room. Step back from the procedure, tell the scrub nurse, tell the surgeon, say, I'm feeling a little bit woozy, and they will immediately escort you out of that room. They're not mad at you. They're not upset at you. They are so happy that you told them and you didn't contaminate their surgical field. Get out of the room, walk around, get a cold glass of water, get that glucose tab out of your pocket, or go grab something to eat. It is nothing you did wrong, and it's common and it happens, and it's okay. A little specific situation here on your peds rotation. Don't act or watch your facial expressions. If somebody's child is being very misbehaved or bad tempered, even if they're being that way, don't act like they're being that way. That child may be sick, they may be broken, they may be uncomfortable, and they're just acting out. Try to just be as professional as you can and watch your facial expressions. You don't need to be beat on by these patients. You don't need to be hit. You don't need to be cursed at. You can, tell that patient like, hey, that's not appropriate, but kind of trying to think why they're acting that way. Big do's on pediatric rotations. Always have a hand on that baby. You may be doing a 2-day check or a 2-week check. Babies are very squirmy and they like to roll. So the last thing you want to do is put a baby on a table, try to listen to their heartbeat and have them roll off. Always have one hand. We talked about that Elmo loves ABCs. Use an app or a video to distract the kids when you're trying to give them shots or do something invasive. It will be a much better experience all around. And the parents will say, oh my gosh, that student was so great with my, little Johnny or little Jenny. They did such a great job of distracting them and they didn't even cry. Discussing patient cases. You are in rotations to learn. It is okay to discuss patient cases. However, do not discuss them anywhere on social media. There has been situations over the years where students have done a procedure and thumbs upping themselves, and you've got the patient's foot in the picture, or you've got the patient's, half of the patient in the picture. Do not ever, ever, ever put anything on your social media about any patients or how proud of you are for doing anything. Don't do it. Don't do it in public areas. Like, let's say you're in the hospital with your preceptor and you get on the elevator, you're talking about patients and somebody else gets on. That's a HIPAA violation. Don't mention any patient identifiers. If you're, discussing this with your friend from, the PA program and you're like, hey, I saw this really cool case, leave out the patient identifiers. You can certainly discuss patient cases with your preceptors, with your faculty members, with your other PA students, if it's a good learning opportunity. Don't just do it if it's like embarrassing or something like that. If it is HIPAA compliant, and a lot of programs require that you do a patient presentation or a patient case. So you can do this, but be very mindful about HIPAA. Helping out around the office. You are not there to be a slave. Okay, so if you're asked repeatedly to do things like getting your preceptor food or coffee, cleaning the toilets, being a fill-in for an employee, that is not why you are there. You need to inform your clinical director that that is the case. But if your preceptor says to you, hey, I'd love for you to learn about the front desk, and they sit you at the front desk, as long as you're following somebody else at the front desk, that's a great experience for you. They want you to follow an x-ray tech. They want you to follow a phlebotomist. They want you to follow a medical assistant. They are trying to give you a well-rounded experience so that you understand how each role of that team works. And when you are a provider, you understand what their challenges are and how most effectively you can work with them as a team. So abuse is a no-no, but asking you to do non-PA student related things in different departments is okay. Getting feedback. Don't ever assume that you're going to be getting a glowing evaluation for the rotation. Ask your preceptor halfway through and say, PA Smith or Dr. Smith, I'm about halfway through this rotation. Can you tell me how I'm doing? Is there anything where you see that I have an area of weakness that I need to improve? This gives them an open opportunity to say, yeah, you're doing a really great job on your presentations, but you're not super friendly with the patients. How about you try being a little bit more, friendly with the patients? And you say, okay, I'm going to do this. I'm going to get better. And they notice through those last 2.5 weeks that, wow, you've really tried to work on that. That gives them something specific to write on your evaluation, that you accepted your feedback and you made improvements based on that. So that gives them a nice opportunity there. Completing the evaluations. At the end of each rotation, your preceptor will give you an evaluation, and also you'll evaluate them. Don't expect your evaluations to be done immediately. So don't walk in on your last day and say, hi, I have this eval. It needs to be filled out in 2 minutes before I leave here. Also, do not be upset if it's not perfect. Some preceptors say, well, you always have room to improve. You don't get all 5s or all 10s because you still have some room to improve. So they may give you a 3 where you felt like you needed more than that. Give your preceptor a few days to fill this out. And when they give it to you, say, would you like to discuss this with me so I can understand the areas that I can improve on future rotations? And then that way they can explain to you why you got that score so that you don't continually make that mistake on your next rotations. Handling preceptor questions about classmates. So let's say your preceptor says, oh, I have Jane Doe is coming on my rotation after you. What is she like? Don't say anything negative about other students that have either been on that rotation or are coming to that rotation. There was a situation where somebody was on a peds rotation and the person before them said, oh, that person hates kids. And so the person walked into their rotation and the preceptor already didn't like them because of what that person had said. If you have nothing nice to say, what's our old adage? Say nothing at all, or say, I've never met them. I don't know them very well. Handling classmate questions about preceptors. So let's say your classmate says, oh, I'm on that rotation next. What was it like? Do not say anything that you would not want to get back to that preceptor. So let's say you and that preceptor didn't really hit it off, but that next student and them do, and they say, oh, well, that student talked really badly about you. You can provide constructive criticism about the rotation, but nothing that is gossipy or hurtful. So let's say that, the preceptor is frequently late. Instead of saying, oh yeah, that preceptor is always late, say, hey, this is some good study time for you. They're usually about 15 minutes running behind. Take some time to study that 15 minutes before. Or, hey, this preceptor, instead of saying they don't like to talk, just say they're usually very busy with charting and they kind of like things quiet. So you can give that person a constructive feedback to say, this is what to expect, but do it in a kind way. Networking, huge. The whole point of this is for you to get a job as a PA, and it is hard to get a job. If you're in an office with, multiple providers, let's say you work with Mr. Smith and you're like, "Ah, gosh, I don't really get along with Mr. Smith. I'd really like to work with Miss Jones or Mrs. Brown." And so you say to your preceptor, "Hey, I really like what they're doing over there. Can I go watch them?" No, that person did not agree to take you as a student, and your preceptor may be hurt by that because you don't want to follow them. If your provider says to you, "Hey, I got jury duty tomorrow and I'm going to be off. Would you like to follow Miss Jones or Mrs. Brown?" You could say, "Yes, that's wonderful. And I love that opportunity." Also, if your preceptor says, "Hey, I've got a pharmaceutical dinner tonight and there might be other doctors there. Would you like to come with me?" Absolutely. Take them up on that invite. You'll meet the pharmaceutical rep who may have contacts. You may meet other providers there that may be, hiring in the future. And that's where you're handing out that business card. Leave a good impression. You want to be remembered as that student that everybody loved rather than that student that they were like, "Oh, thank God that person's gone." Do not text or call your preceptor after you leave that rotation. Email is always much more professional. And don't just bother them to be like, "Oh, hey, just checking in, saying hi." If you had discussed, you said you would write a letter of recommendation for me, in that email, "Dear PA Smith, you said you would write this letter of recommendation. I'm just following up on that. Would you still be okay with that?" That is fine. Do not give their cell phone number to any students, whether they're upcoming, whether they've been there before. The preceptor has the right to give their cell phone to whoever they decide. It is not your prerogative to do that. Always bring treats on the last day for the staff. You would much rather be known as the donut student rather than like the miserable student. So $12.99 at Dunkin' Donuts goes a long way for giving that staff a treat and saying, "Hey, thanks for precepting me." You also want to send a handwritten note within about 2 weeks. Sometimes people go extra and they send them a little like $5 Starbucks card. That's not necessary, but it just shows that you're appreciative for the time that they took out to teach you. I want to wish you all good luck. Thank you for watching this video and thank you for subscribing to our YouTube channel. If you have any other questions, I am certainly happy to answer them, but I want to wish you luck in your future endeavors.